According to the Consumer Healthcare Products Association, Americans spent about $35.2 billion on non-prescription remedies in 2018. This was more than double the amount spent in 2008. Over-the-counter or OTC drugs are drugs that have been approved by the US FDA that do not require a prescription to purchase due to the fact that they've been judged to be safe when directions are followed and they have a low risk of abuse. Parents, neighbors, and family members will likely seek your knowledge when purchasing OTC products. You need to know how to advise them in a well-informed way that will answer their questions. Patients do not always think to mention their herbal products because they may regard these as natural and safe. Many Americans will consider over-the-counter products to be safe because they're available without a prescription. When taking a drug history, always ask your patients if they're taking over-the-counter or herbal drugs, and be sure to document the answers. Ask your patients to bring in all herbs or drug remedies that they're using so that we can accurately record them. There are several reasons that patients would use over-the-counter herbal or complementary products. They may be seeking products that they hope will keep them in good health, prevent disease, or provide treatment for any health problems they currently have. They may have tried traditional treatment and drugs without success. Maybe the traditionally prepared drugs had undesirable side effects. There is no current drug therapy that can cure their problem. Trusted people in their family or community have advised them to take the product. They are seeking a cheaper drug to replace a prescription drug. Traditional drugs or treatments may violate their religious or spiritual beliefs, or they may seek a more integrative medicinal approach to their health care. The annual sales of over-the-counter products are estimated at $38 billion. Over-the-counter products are different from prescription drugs in the following ways. The label information will be more complete than the information on a prescription drug label. Over-the-counter drugs will have a wider margin of safety due to the substantial testing they've undergone before advertising. Over-the-counter drugs are widely available and advertised. The dose is often lower with the same drugs available for prescription use. These products are typically not covered under insurance. Drugs that were once available only by prescription have now been given over-the-counter status, often in lower dosages than the prescription formulations. Over-the-counter drugs can be sold in pharmacies, grocery stores, gas stations, and department stores. The FDA requires that over-the-counter drug product labels contain important information in a manner that a typical person would be able to read and understand. Key information begins with the names of the active ingredients, followed by the drug's purpose, use, warnings, directions, and other information, including the names of the inactive ingredients. Surveys have shown that women are the family members more likely to buy over-the-counter products. They are also more likely than men to read the labels before taking the drug. One of the most important things to look for on an over-the-counter label is the presence of any other chemicals in a product that could pose a risk. These are often known as hidden chemicals. Healthcare providers should tell patients some basic facts about over-the-counter products. Some key facts that patients should learn is to always read the instructions on the label. Do not take over-the-counter drugs in higher dosages or for a longer time than the label instructs. If you do not get well within 2 weeks, stop treating yourself and see a healthcare professional. Side effects from over-the-counter drugs are relatively uncommon, but be sure to read the drug label so you know what they are. Responses to drugs will vary from person to person. Over-the-counter drugs can interact with other drugs as well as food and alcohol. They can even have an effect on your other health problems that you may have. Be sure to ask your pharmacist if you're not sure about any interactions. If you don't understand the medication label, ask a pharmacist. Do not take a drug that does not have a label on it. Throw away drugs that have expired. Do not use drugs that belong to a friend. Buy products that treat only the symptoms that you have. If cost is an issue, generic over-the-counter products are cheaper than brand name items. Avoid buying products online, outside of well-known internet insurance company sites, because many over-the-counter preparations and sold through the internet are counterfeit products. They may not actually be what you ordered, and they could be dangerous. Parents should know the following special information about using over-the-counter drugs for their children. You should never guess about the amount of drug to give to your child. 1/2 of an adult dose may be too much or not enough to be effective. This is very true with drugs such as Tylenol and ibuprofen, and repeated doses can lead to poisoning of the child, liver destruction, or coma. If the label says to take 2 teaspoons and the dosing cup is marked with ounces only, get another measuring device. Do not try to guess about how much medicine should be given. Always follow the age limits listed. If the label says the product should not be given to a child younger than 2 years old, do not give it to them. Always use the child-resistant cap. Relock the cap after use and keep all drugs in a safe place far away from children. Throw away old, discolored, or expired drugs and any drug that has lost its label instruction. Do not give children any drugs containing alcohol. Evidence-based research for many alternative therapies is often absent, and the safety and efficacy of many are unclear. The NIH Center for Complementary and Integrative Health sponsors and publishes research based on the scientific evidence regarding many alternative therapies. A dietary supplement contains one or more ingredients, such as vitamins, herbs, botanicals, or amino acids. However, regulations for dietary supplements are not the same as those for prescription over-the-counter drugs. According to the FDA, a dietary supplement must be labeled as such and must be intended to be taken only as a dietary supplement. Producers of dietary supplements are responsible for ensuring that products are safe. However, they do not have to provide the FDA with information that demonstrates the safety of their product before it can be marketed. If a claim is made about the effects of a dietary supplement, the producer needs to have data to support that claim. Any claim about how a supplement may affect the body needs to have a following statement on the label. This statement has not been evaluated by the U.S. FDA. This product is not intended to diagnose, treat, cure, or prevent any disease. The FDA has the authority to remove a product from the market, but this can only happen after the agency has proof the product is unsafe or ineffective. This was the case with ephedra. Labeling on herbal products is generally, the FDA does not regulate any herbal supplements. Labeling on herbal products is generally designed to promote sales and product use and is not necessarily to educate the consumer. Patients with medical problems should not use herbs or dietary supplements without medical supervision. Some herbal products do have adverse effects, and many herbal products will interact with prescribed drugs. Safety, purity, and effectiveness are the major issues in evaluating herbal products. Herbal products are made by grinding up parts of plants and making them into pills, capsules, or liquids. One of the major criticisms of herbal products is that the plants vary widely in concentration or dosage. Some plants may contain harmful pesticides or other chemicals. Hormone replacement therapy has become a hot market for the use of natural products. Natural estrogens are really estrogen-like chemicals called phytoestrogens. Supplements with these ingredients have not been clearly shown to improve the symptoms of menopause. Many non-prescription products are advertised to have the same function as prescription drugs. Some products may include amphetamine-like compounds that can cause high blood pressure, heart rate irregularities, stroke, and death. St. John's wort has been shown to improve mild to moderate depression, but has potentially dangerous interactions if taken with selective serotonin reuptake inhibitors, benzodiazepines, warfarin, statins, verapamil, digoxin, cyclosporine, antiviral HIV drugs, or oral contraceptives. The human body contains an endocannabinoid system that maintains homeostasis and certain body processes. This system is active with or without the use of cannabis. Research has shown that the endocannabinoid system affects our appetite, digestion, pain, inflammation, moods, sleep, and stress. Cannabis, or marijuana, and its active compounds will interact with the endocannabinoid system and have an array of effects of the human body. The main active compounds are delta-9 tetrahydrocannabinol, or THC, and cannabinol, or CBD. Cannabis affects individuals in different ways, and little is known regarding the safety of the over 400 compounds that are present in cannabis. Basic and clinical research on the use, safety, and efficacy of CBD is now legal, and clinical trials to determine the risk and benefits of CBD can be conducted. Research shows that THC decreases nausea and increases appetite. THC can also decrease pain and inflammation. THC use by pregnant or nursing mothers can have negative long-term effects on the child, according to animal studies. CBD can be useful in treating inflammatory conditions, pain, seizures, and mental health disorders such as substance abuse. Some common side effects of cannabis include dry mouth, sedation, cough, dysphoria, anxiety, reddened eyes, altered visual perceptions, lack of coordination, and altered sense of time. The drug interaction studies that have been done on warfarin have shown that THC and CBD can increase warfarin levels as well as the INR. The active dose of cannabis is well below the lethal dose, and serious adverse effects of using cannabis are considered rare. Symptoms of bronchitis are associated with smoking cannabis, and these symptoms will worsen when it's used concurrently with tobacco. Although medical cannabis is considered safer than unregulated cannabis, contamination by pesticides, fungi, and bacteria can occur, and this increases the risk of pneumonia as well as other respiratory problems. On page 369, look at the orange memory jogger box. St. John's wort, ginseng, and golden seal are common herbal products that are most likely to cause dangerous interactions with many prescription drugs. Many products gaining attention in the United States have actually been used for years in other countries as over-the-counter products or by prescription. A few non-herbal natural remedies in common use are considered safe and effective. Sometimes products such as calcium can be of proven use. Vitamins are chemical compounds that are found naturally in plant and animal tissues, but most are not made within the human body. Some are available in their active form, and others will come from food as a precursor or provitamin that will later be converted into its active form. Most people who take vitamins will decide to do so on their own without the advice of a healthcare professional. Vitamins are necessary for life and essential to our normal metabolism. Fat-soluble vitamins are found primarily in various plant and animal oils or fats, and these can be stored within the body so that daily intake is not essential. Water-soluble vitamins are readily excreted in the urine, and they are not stored in the body. Water-soluble vitamins are quickly destroyed by heat, and deficiencies can be seen in patients with a deficient diet. Normally, if a well-balanced, nutritious diet is followed, vitamin supplements will not be necessary. Vitamin supplements are advised for conditions in which metabolism is increased, such as hyperthyroidism, pregnancy, and burns. If a variety of healthy foods are eaten, the necessary vitamins can likely be obtained from your diet alone. When patients are deficient in one or more vitamins, supplements are needed. For supplementation, vitamins should contain 50 to 150% of the RDA per dose. Excesses of fat-soluble vitamins, including vitamins A, D, E, and K, can be stored, and high levels as well as toxic side effects can occur. Advertisers suggest that natural products are better than synthetic vitamins. The human body processes vitamins in the same way, whether they're natural or synthetic, costly or cheap. The most important difference is that some of the preparations may dissolve better than others, or may contain the active product in amounts that will increase the absorption of other vitamins and minerals taken at the same time. Vitamin A is important for vision, gene expression, reproduction, embryo growth and development, and a healthy immune system function. Hypervitaminosis can occur if vitamin A is given in high doses for a long time. Hypervitaminosis will result from excessive intake and a high storage level of one or more vitamins, notably our fat-soluble vitamins, and this can lead to toxic symptoms. Any patient receiving more than 3 times the amount of vitamin A RDA of 900 micrograms needs to be closely supervised. Pregnant women should not receive more than 1,300 micrograms daily, or they may risk fetal abnormalities. Common food sources of vitamin A would include dairy products, fish, liver, spinach, broccoli, and dark orange vegetables. Women using oral contraceptives should take only the prescribed amounts of vitamin A to avoid hypervitaminosis. Early indications of vitamin A overdose include anorexia, abdominal pain, malaise, yellowing of the skin, especially on the nose and ears. Vitamin B1 or thiamine is a water-soluble vitamin and a coenzyme needed for many physiologic pathways involved in carbohydrate metabolism and energy production within our body. Other conditions that can lead to vitamin B1 deficiency include alcoholism, gastric lesions, or hyperemesis of pregnancy. Usual reactions to thiamine include mild itching, sweating, and nausea. However, adverse reactions can be severe and include anaphylactic shock and even death when thiamine is given IV. If giving thiamine to an alcoholic or thiamine deficient patient, IV glucose should also be given to prevent the precipitation or worsening of Wernicke's encephalopathy. Common food sources of thiamine would include meats, whole grains, peas, dried beans, and peanuts. Thiamine in food is destroyed when food is boiled, fried, or cooked for a long time under pressure. Vitamin B2, or riboflavin, is a water-soluble vitamin and is very important in the metabolism of proteins, fats, and carbohydrates. It will combine with proteins to form enzymes that are important for tissue metabolism. Riboflavin can be used to prevent or treat riboflavin deficiency. Riboflavin levels in the body can be decreased by oral contraceptives, even when taken in low doses. Teach patients that common food sources of riboflavin include dairy products, eggs, green leafy vegetables, organ meats, and peanuts. Warn the patient that riboflavin supplements can turn the urine a yellow, deep color. Niacin was previously called vitamin B3. It is a water-soluble vitamin and is an essential part of two compounds important in generating cellular energy. It is used to prevent or treat deficiency states that can cause pellagra or as a nutritional supplement in cases of limited dietary intake. Niacin can also be used to treat conditions of high blood fat levels, such as hyperlipidemia, hypertriglyceridemia, and atherosclerosis. Expected side effects of niacin supplementation are skin warmth, flushing, and itching. These can be relieved by giving aspirin with the niacin. Adverse reactions to niacin would include allergies and anaphylactic reactions. Food sources of niacin include peanuts, yeast, cereals, eggs, liver, red meats, whole grains, and enriched bread. When taken with beta-blocking drugs and calcium channel blockers for hypertension, the side effects of niacin will increase, especially the skin warmth, flushing, and blood vessel dilation. This effect can lead to postural hypotension. If dizziness occurs with niacin, tell the patient to sit or lie down. Vitamin B6 is peroxidine. This is used to treat peroxidine deficiency, vitamin B6 responsive chronic anemia, neuritis, and other rare vitamin problems. Peroxidine deficiency is most likely to develop in the older adult population and in women of childbearing age, especially those who may be pregnant or breastfeeding. Women who are taking oral contraceptives, individuals who are alcoholics, and those whose diets are poor in the quality and quantity of protein or high in refined foods are also at risk. Oral contraceptives can induce peroxidine deficiency. Good food sources of vitamin B6 would include bananas, avocados, potatoes, poultry, egg yolk, liver, kidney, muscle meats, fish, chickpeas, and whole grains. Limited amounts are available within milk and vegetables. Appropriate food preparation is important in preserving this vitamin. Freezing vegetables will result in a 20% loss of peroxidine, and milling wheat will result in a 90% loss. Folic acid, or vitamin B9, is required for normal erythropoiesis and DNA synthesis. Guidelines emphasize the importance of increased folic acid intake by all women of childbearing age, especially for those intending to get pregnant and during the early pregnancy to prevent spinal cord malformations in the fetus. Folic acid will interact with several drugs. Vegetables and fruit are good sources of folate. In the United States, bread, cereal, flour, pasta, rice, and cornmeal are fortified with folic acid. Beef, liver, peas, beans, nuts, and eggs are also good sources of folate. Vitamin B12, or cyanocobalamin, functions within many processes for protein, fat, and carbohydrate metabolism. Vitamin B12 is needed to form red blood cells, and it is essential for growth, cell reduction, and making the myelin sheath that surrounds the nerve cells. Intrinsic factor needs to be present in the stomach for the small intestine to absorb B12. Symptoms of deficiency can occur mainly in people on strict vegetarian or vegan diets. Most patients with vitamin B12 deficiency have a malabsorption problem in the GI tract, pernicious anemia, or alcoholism, or they're on a vegan diet. An allergy to vitamin B12 is very rare. The best food sources of vitamin B12 would include organ meats, fish and seafood, eggs, non-fat dry milk, fortified non-dairy milks, and fermented cheeses. Vitamin C, or ascorbic acid, is necessary for the formation of collagen in connective tissue, cartilage, tooth dentin, and skin, as well as for bone matrix and tissue repair. It is essential for energy-producing reactions and in metabolizing some neurotransmitters, hormones, carbohydrates, and amino acids. It helps maintain the integrity of blood vessels and may promote resistance to infection. Vitamin C will regulate iron distribution and plays a role in antioxidant renewal. The use and dosage of vitamin C in the prevention and treatment of diseases other than scurvy is currently uncertain. The patient can experience a mild, brief soreness at the injection site when this is given IM or subcutaneously. Excessive doses are typically rapidly excreted into the urine. Ascorbic acid can affect anticoagulants, blocking the action of some and prolonging the intensity and duration of others. Ascorbic acid will increase the effect of salicylates through increased kidney reabsorption. Ascorbic acid will decrease the effect of tricyclic antidepressants by decreasing kidney reabsorption. Smoking can increase the need for vitamin C by decreasing ascorbic acid serum levels. Vitamin C is easily destroyed by air, heat, and light. This drug needs to be kept tightly capped in its own container. Foods high in vitamin C should not be boiled for long periods of time or left uncovered in the refrigerator. Good food sources of vitamin C include oranges, grapefruit, strawberries, cauliflower, cantaloupe, beef liver, asparagus, green leafy vegetables, and potatoes. Vitamin D. The main action of this group of vitamins is the movement of calcium and phosphorus ions into three main sites: the small intestine, the kidneys, and the bone. Vitamin D3 contributes to skin growth and repair. It is used in the treatment of some skin disorders. The dosage of vitamin D needs to be planned for each patient and given under close supervision because the range between therapeutic and toxic levels is very narrow. Vitamin D levels do not need to be measured for everyone, but they are recommended to be measured for those who are homebound or in long-term care centers or other institutions. Other than sun exposure, natural sources of vitamin D are few, and most vitamin D is obtained from fortified sources. Vitamin E. Vitamin E is an antioxidant with neuroprotective and anti-inflammatory properties. As an antioxidant, it may prevent damage to cell membranes. It stabilizes red blood cell walls and protects them from breakage or destruction. It may also increase the effect of vitamin A and stop platelet aggregation. Many suggested uses of vitamin E are controversial and unproven. The only established use is to prevent or treat vitamin E deficiency, which is rare in the United States and is usually the result of impaired metabolism. Vitamin E has been touted as a powerful antioxidant and may play a role in reducing heart disease and atherosclerosis. Vitamin E appears to be the least toxic of the fat-soluble vitamins. No signs and symptoms of toxicity or hypervitaminosis have been identified in humans. Food sources of vitamin E are primarily plants. The highest amounts are found in vegetable oils and in nuts, wheat germ, rice germ, and green leafy vegetables. Meat and dairy products provide less vitamin E. Vitamin E products should be stored in tightly closed, light-resistant containers. Vitamin K. Vitamin K is most abundant in fermented foods, eggs, dark chicken meat, and goose liver. Vitamin K can be found in leafy greens and other vegetables. It is the main form of vitamin K supplement within the United States. Vitamin K helps liver formation of factors 2, which are essential for normal blood clotting, although the exact mechanism is unknown. Vitamin K does not counteract the anticoagulant activity of heparin, although it is helpful in reversing the effects of Coumadin overdose. Severe hypersensitivity reactions can occur. Anaphylactic shock, including cardiac arrest, respiratory arrest, and death, have occurred during and immediately after IV injection. The use of vitamin K along with oral anticoagulants, especially warfarin, can decrease the effects of an anticoagulant. Vitamin K is an antidote to warfarin toxicity. IV administration is not recommended due to the risk of anaphylaxis. Minerals are inorganic substances found in food. 19 minerals are found within the body, and at least 13 are essential for our normal metabolism and function. Minerals will act as catalysts to speed up various biochemical reactions. They are obtained from a diet that includes a variety of animal and vegetable products and meets the energy and protein needs of the body. Calcium, iron, and iodine are the 3 elements most frequently missing within the diet. Calcium is a major mineral within the body and is essential for muscular and neurologic activity, especially within the cardiac system. Calcium is important in the following actions. It assists in the formation and repair of skeletal tissue. It activates several enzymes that influence cell membrane permeability and muscle contraction. It aids in blood clotting by stimulating the release of thromboplastin and the conversion of fibrinogen to fibrin. It activates pancreatic enzymes for digestion. It increases the intestinal absorption of cobalamin. It is involved in the transmission of neurotransmitters and in the metabolic processes. It helps regulate some white blood cell functions. Vitamin D is essential for the absorption of calcium within the body. Calcium status can be affected by the calcium to phosphorus ratio in the body, as well as the level of protein in the diet. Calcium should not be given to patients who already have kidney stones. Milk, cheese, yogurt, bok choy, tofu, okra, broccoli, almonds, and fish canned with bones are the richest sources of calcium. Egg yolks and most dark leafy green vegetables are also good sources. Iron is a mineral that is essential for the body to produce myoglobin and hemoglobin. It stimulates the hematopoietic system and increases the production of hemoglobin to correct iron deficiency. Iron is used to treat symptomatic iron deficiency anemia only after the cause of anemia has been identified, and it is used to prevent hypochromic anemia during infancy, childhood, pregnancy, and breastfeeding. It can also be used in some patients recovering from other anemias and after GI surgeries. Expected reactions to iron supplements would include constipation and cramping. Symptoms of overdosage can occur after 30 minutes to several hours. These symptoms would include lethargy, nausea, vomiting, abdominal pain, diarrhea, melena, and dyspnea. More iron is absorbed if the iron is taken on an empty stomach with water or in an acid environment, although taking it with meals can reduce some stomach irritation. All simple oral iron preparations are available over the counter. Fish, red meat, spinach, and dried fruits are the best sources of dietary iron. Iron supplements can cause dark green or black stools. Tell your patient to report any constipation, diarrhea, nausea, or abdominal pain to their healthcare provider. Magnesium is an electrolyte that is essential for several enzyme systems. It is important in maintaining osmotic pressure, ion balance, bone structure, muscle contraction, and nerve conduction. This mineral is especially important in cardiac function, and only slight deficiencies can prolong the QT interval and lead to a very dangerous form of ventricular tachycardia called torsades de pointes. Magnesium deficiencies are seen primarily when malabsorption syndromes are present. Magnesium is available in adequate quantities in meat, milk, fruits, and vegetables, and a special dietary planning is not necessary. Large amounts of magnesium are present in spinach, chard, and pumpkin seeds. Potassium is the principal intracellular positive cation in most body tissues, acting in the maintenance of normal kidney function, contraction of muscle, and transmission of nerve impulses. It is found within the body in a very narrow concentration range. An excess or deficit of potassium can cause symptoms. Adverse reactions to potassium supplements would include nausea, vomiting, diarrhea, abdominal discomfort, and GI bleeding. Potassium should not be used in patients who are receiving potassium-sparing agents, such as aldosterone antagonists or trimetherine, because overdosage can develop. All potassium supplements need to be diluted properly or taken with plenty of liquid to avoid producing any GI ulcers. The dosage must be titrated based on the patient's needs, and the patient needs to be closely watched, especially during the initial stages of therapy. A potassium-rich diet would include foods such as bananas, tomatoes, citrus fruits, apricots, and dried fruits such as raisins, prunes, and dates. Fresh cantaloupe and watermelon, nuts, dried beans, beef, and fowl also contain ample quantities of potassium. Zinc is a part of many enzymes and is essential for normal growth and tissue repair. Zinc functions in the mineralization of bone and in the detoxification of methanol and ethylene glycol. It plays a role in the creation of DNA and the synthesis of proteins from amino acids. It is important in wound healing and functions in moving vitamin A from its liver stores. Patients who are taking zinc may report abnormalities in taste and smell, rough skin, and anorexia, with a profound disinterest in food. Adverse reactions to zinc supplements would include gastric ulceration, nausea, and vomiting. Seafood and meats are rich sources of natural zinc. Cereals and legumes also have significant amounts of this mineral.